I remember a young lady who I met about 3.5 years ago. She was, I guess, about 10 or 11 at the time. She actually developed severe, untreatable, incurable lung disease. But she couldn't talk, of course, because she had the breathing tube in. And she expressed that to me. So what I did was I made adjustments on the ventilator and with her breathing tube that allowed her to talk for the first time since she had been here. It was like magic, honestly, because she could hear her voice again. She could talk again. And I'm getting choked up. I had to go back to my office and take a break. And when I came back to her room, her parents were crying and she was crying. And but it was a moment that allowed her to speak and actually tell her family what they meant to her. And 48 hours later, she was gone. Being able to do those types of things, frankly, gets me up in the morning and gets me in here early.
I think the thing that's been so nice here would be the fact that the families are very reassured. But when you usually end up mentioning that I do operate at Akron Children's here in the Mahoning Valley, I think there's a great deal of just reassurance from that the families know that already that there's pediatric preoperative care and there's a child life person who's here now, and it's pediatric anesthesiology and pediatric post-op care, and everything is aimed towards the children. The parents and the way that they present themselves, their child is watching them, and their need for calm is very, very important. It's what one of my old friends used to say, they need to act like a duck, where on the surface they're nice and calm and underneath they could be paddling like crazy, but they need to be calm, and that the child picks up on that. And though it's very emotional for them in making even the decision process, that you just want to reassure everybody best you can. You know, I learned a long time ago, I didn't deal the cards, I just help you play them.
That conversation is with the parents is always difficult on the first pass, because I know that they don't hear me beyond the fact that the baby's heart's abnormal. And with certain heart defects that are very complex, you really have to kind of go over it again and again and again, multiple times. One of the things that I love about my jobs is watching how the parents mature over time, and how with the progression of time, they get it. Oftentimes it's a very young couple that may have had no experience with a baby at all, and then within a few months they blossomed into almost critical care nurses. They're so good at being in tune with their baby.
I can think of a little boy that was born and brought to our special care nursery because he was born too early. And I remember the parents coming down to visit him for the first time and were just completely overwhelmed and scared and didn't know how to parent him or what their role was. But you could tell that they so desperately wanted to bond and do that. And I remember taking care of him a lot, but you also nurture the family as well. And I kind of had to take care of them and teach them that they're not going to break him, and this is how you do things. So something as simple as just getting in the isolette to touch him around all of the wires and the IV tubing, something so natural as touching was a challenge. And it's just overwhelming for parents to be separated from their baby when they're in the special care nurseries. And it's sad to say, but it's good to see them go. That's a happy time when they get to go home and take their baby, even though you'll miss them, but it's time for them to go home and be a family.
And knowing that what we do involving complete strangers, frankly, they don't know us and we don't know them, but they trust us enough to bring their kids for us to care for them. And so we really feel burdened to do right by them every time.